How does pregnancy impact your pelvic floor muscles? This is a question that comes up in my office all the time, especially with my young moms or soon to be young moms, young women who are considering pregnancy. So in today's video, I'm going to break it down for you, and we're going to be discussing how does your pelvic floor muscles get affected both during pregnancy, at the time of delivery, as well as postpartum. Hi everyone, I'm Dr. Nabila Noor, board certified and fellowship trained urogynecologist and a pelvic reconstructive surgeon. Welcome to my channel. If you're new to the channel, welcome. Here we talk about everything pelvic health, and if you like what you see, don't forget to subscribe and share it with a friend. Especially today's video, definitely share it with a new mom in your life or a soon-to-be new mom. Trust me, they'll thank you. So let's start with talking about the pelvic floor muscles during pregnancy. And to make it easy to understand, I'm going to break it down into the first trimester, the second trimester, and then the third trimester. So first trimester is the week 1 to week 12 of pregnancy, or the first 3 months. Now, as you can imagine, a lot of women may not even know during this time that they're pregnant. However, your body is already starting to go through a lot of changes which can already start to affect your pelvic floor muscles. Specifically, hormonal changes. Your body starts to produce a hormone called relaxin and progesterone, which helps, as the name suggests, relax your pelvic floor muscles, your connective tissue, as well as your ligaments, which can affect the stability of your pelvic floor. There's also increase in your blood flow because there's a lot of fluid shift that's happening as the baby starts to develop, and this can cause symptoms of pelvic congestion, which can lead to feelings of heaviness in your pelvis. Also, a lot of women suffer from nausea, fatigue, and vomiting during their first trimester, and as a result of which they're not really doing a lot of physical activities or physical exercises, which also can lead to deconditioning of your pelvic floor muscles. Another thing to remember is that a lot of women are starting to take their prenatal vitamins during their first trimester, which contains things like iron, which can make you constipated, as well as the hormone progesterone that I mentioned. It slows down GI motility and again causing constipation, which also can affect your pelvic floor muscles, especially if you're straining to have a bowel movement on a regular basis. So even though there are no obvious outward changes that's happening to your pelvic floor, because of the hormonal shifts and the hormonal changes, the pelvic floor muscle elasticity is affected. And a lot of women may already start noticing that they're waking up at night a lot to go to the bathroom and also having a lot of urinary urgency and frequency. The second trimester is between week 13 to week 26, which essentially is month 4 to month 6 of the pregnancy. So this is when the baby starts to get a little bit bigger. The mom's also gaining a lot of weight, which affects her posture. It can also put increased pressure on the pelvic floor muscles. The uterus is putting more pressure on the bladder as well as the pelvic floor, all of which can lead to things like urinary incontinence, specifically with laughing, coughing, sneezing, which is known as stress urinary incontinence. Also, because the uterus is getting bigger as the baby gets bigger, it pulls on the ligaments that's supporting your uterus. So something we called round ligament pain. A lot of women may also notice pain in the bones around the pelvis, something we called pelvic girdle pain. And finally, the third trimester is between week 27 to week 40, and essentially the last 3 months of pregnancy. This is where, the baby is increasing weight on a weekly basis. The moms themselves gain a significant amount of weight, and as a result, all of this can put a lot of pressure on your pelvic floor. And also the hormone relaxin is at its peak, which again relaxes your ligaments and relaxes your connective tissues, enabling the body to get ready for the process of delivery. Now, at the time of delivery, depending on whether you're having a vaginal delivery or a cesarean section, it can affect your pelvic floor muscles separately. Let's talk about vaginal delivery first. Now, of course, as you can imagine, for vaginal delivery, there's a lot of stretching that can happen in the pelvic floor muscles, especially as the baby's head is trying to push through the vaginal canal. Now, in general, the vaginal opening is only about 3 to 4 centimeters. But to accommodate a baby's head, that vaginal canal has to stretch to almost 10 centimeters for the baby to be able to come out. As a result of this, there can be stretch injury to the nerves, to the muscles. Sometimes women develop lacerations, which again can range from 1st degree to 4th degree, and depending on how severe it is, there could be damage to not only the muscles of the vagina, but also to the sphincter muscles near the anal canal where stool comes out of. Sometimes some women may need an episiotomy, which is an artificial incision that the physicians will have to make to allow the baby's head to be able to come out easily. There are times when we have to do an operative vaginal delivery, which is using instruments such as forceps or vacuum to get the baby out quickly. And again, all these can affect your pelvic floor muscles. Now, is C-section 100% protective for your pelvic floor muscles? Not necessarily, especially if you're having a C-section after having labored for a long time and failed a vaginal delivery. Now, a scheduled C-section does cause less damage to the pelvic floor muscles, but then remember, a C-section is a major abdominal surgery, so you are going to have an abdominal incision in your abdominal muscles, in your skin, and so that can affect your core strength as well. And of course, recovery from a cesarean section is very different than recovering from a vaginal delivery. Finally, the postpartum period. Remember, there's still hormonal changes that's happening to your body even after you've delivered the baby, especially something called a genitourinary syndrome of lactation, meaning women who are breastfeeding, your body has a decreased amount of estrogen, which can affect the tissue quality vaginally, as well as cause symptoms such as urinary urgency, frequency. A lot of women will notice that they have a lot of vaginal irritation, a lot of dryness, almost mimicking symptoms that menopausal women have. And the reason is because the basis of why these changes happen are very similar. It's the lack of estrogen that affects the tissue quality, the elasticity, all of which can affect your pelvic floor and exacerbate pelvic floor symptoms such as dryness, irritation, pain with intercourse, urinary symptoms, urinary leakage, as well as bowel function. And depending on whether or not there was a lot of tear or lacerations in the pelvic floor area, you might have stitches, which does take time to heal. So there may be some swelling, which again can take up to weeks to recover. So how do you protect your pelvic floor muscles during pregnancy and after? So ACOG, which is the American College of Obstetrics and Gynecologists, recommends that it is okay, and in fact recommended, that for women with uncomplicated pregnancy, they should engage in some form of exercises, whether it be simple aerobic exercises, as well as strengthening and pelvic floor conditioning exercises. Of course, you modify these exercises based on your particular situation, as well as depending on what trimester you're in and how much your body is able to take. So something that I often recommend women is, if you're in a place and have access to group exercises that's focusing on pregnant women, definitely something to consider. There are also lots of online information available in today's day and age of social media, but make sure you're looking at programs that's specifically made for pregnant patients and not just any exercises. And if you're interested, always talk to your OBGYN or your midwife and see if they can have some recommendations for you so that you can continue to be fit throughout your pregnancy, as well as strengthening your pelvic floor muscles so that it's not an extended period of time when your pelvic floor muscles have been completely deconditioned. Now, in the postpartum period, it is really important to give your body the time it needs to heal. We all want to go back to our pre-pregnancy body as soon as the baby is out, and there is a lot of pressure on women, especially when there's so much, media out there showing perfect mom body immediately after they've had a vaginal delivery. Understand that it's a very curated view, so don't get caught up in the hysteria. Give your body the time and the grace that it needs to recover. In fact, for the first 4 to 6 weeks, you really shouldn't be engaging in any vigorous exercises, because for tissue healing to take place properly, there's a lot of inflammation that needs to go down, there's a lot of remodeling, and there's a lot of tissue regeneration, and all these takes time. Once you've been cleared by your OBGYN and they've done a good pelvic exam, or they've checked out your abdominal scar and they've given you the clearance to engage in more physical activity, start slowly. Start with something simple like taking a walk for 10 minutes, 15 minutes. See how you do, see how your body feels. Slowly increase the intensity. And again, if possible, do it with guidance, whether it be a pelvic floor physical therapist or a physical trainer. And if there's anything that you're doing that does not feel good to your body, take a step back, allow your body to heal, and then you can always restart. In addition to exercises and pelvic floor exercises, I'm also a big proponent of focusing on your breathing techniques, on your posture, on your body mechanics. Because remember, after you have a baby, your day-to-day activities are going to change because you're going to be carrying a baby all the time, whether it be for breastfeeding or just holding the baby in general. Carrying those big baby carriers as well as strollers those are heavy. So focusing on body postures, whether when you're lifting your baby from the floor or just leaning over, whatever it is, focusing on correct postures can not only help your body mechanics and overall health, but can also have significant impact on improving your pelvic floor strength. Focus on strengthening your pelvic floor muscles. We talk a lot about Kegel exercises, and I have many videos where I talk about how to do Kegel exercises correctly, as well as specific exercises to help strengthen your pelvic floor and core muscles. Now, sometimes if you're having difficulty in trying to understand whether you're doing your pelvic floor muscle exercises or in general your body mechanics or your body postures are correct or not, working with a trained pelvic floor physical therapist can be really helpful because they can really guide you and make sure that you're doing these exercises correctly and in the right way to help improve your pelvic floor muscle strength. In summary, yes, your body goes through a lot of changes that happens during pregnancy as well as after, just like your life is very different once you have a baby. But with the right guidance, with the right focus, the right education, and the right exercises, it is possible to get your pelvic floor strength back so you can continue to live a life where you don't have to worry about pelvic floor dysfunction. And if you ever have questions or concerns, always a good idea to get a referral to see a specialist, especially a urogynecologist, who can talk to you about these options and guide you in your journey. If you found this video helpful, definitely put it in the comments section if you'd like to see more of these kind of videos. And if you haven't already, don't forget to subscribe. And like I mentioned before, share it with a new mom in your life. They will thank you, and I'll see you next week. Bye.